So now, once you are ready to do the scan, of course, by that time, the first thing usually is you introduce yourself, of course. You explain to the client or the patient or the mother, or whoever you're doing the scan, why are we doing the scan and what is expected of her. We're doing the scan most of the time is for gynecologists, is for the pelvis, or if they're pregnant, you check the status of the baby. So you'll have explained everything to the mother. Then you need to just expose the place where you are examining. So if you're examining the pelvis, you'll only expose the pelvis only. If you are doing the pelvis plus the abdomen, you have to expose up to that place where you are doing the scan. And you make sure the mother is comfortable. You ask them, are you comfortable? Can we proceed? At any one time, if you feel uncomfortable or you're not feeling well, you can always stop me. Okay? As I had mentioned about the gel, now this is the first thing that we use. The gel, usually apply it. That is where you want to do the scan. This usually helps you to get better images when you're doing the scan, so that when you're putting this probe has to lie over the gel. So if you do the scan directly on the skin, you might not be able to get the right images that you want. So you usually do the scan this way, then you look at the screen, what you're able to see, and boom, there you go. Now you can be able to see that scan over there. You can see a very beautiful uterus over there. We are a checker. Even the machine is showing that she's laughing. Yeah. I'd mentioned your bladder has to be filled with a lot of fluid to assist us do a better scan. If you can see here, there is this dark area. That dark part is usually fluid, so that is urine in the bladder. So you'll get a better image of the uterus, which is there, if you do if you have a full bladder, as opposed to when there's nothing in the bladder. So you'll scan around, you go left, then you come this other side, you do your scan, then you also turn the scan to be on that side, that position. So as you're doing this, you are looking at the images. So once you get a good image when you're doing the scan, you can freeze that. You can freeze. You can see that one is still. Then you print that image. You can even measure. You can measure the size of the uterus, the size of the ovaries. Then you print that part. Then you unfreeze again. You go to another part. You look at another organ. Maybe you want to look at the ovaries. You look at them there, then you freeze again. So when you're doing the scan, it depends with what you're looking at. Is it the uterus? Is it the ovary? Is it the cervix? All of them, you can get it from the image. Then as you're doing it, if the patient has any questions, you can always they can always ask and answer. And you can even show them what you're seeing. So that way you'll be able to pick everything from the scan. Then once the doctor gets the report, they'll be able to interpret the report of the scan. They will look at the images and also relate that to the symptoms that the patient presented with. And if they'd examine the patient, then they come up with a diagnosis. So basically that's how we do the scans. And The patient will be happy and the doctor will be happy. They have a diagnosis, and after that you'll offer treatment. Then once you're done with the scan, of course you have to wipe off the gel gently. Some patients will request they wipe themselves, but we usually encourage you just wipe it, all of it. You okay, Mama? Then you tell them to wait outside as you print, you type and print your findings, and they will present the same to the doctor, who will explain the details. Usually the person doing the scan, if it's not the gynecologist doing the scan, sometimes they may not explain to you all the details because they don't know what diagnosis the doctor has or the other details, and they cannot tell you about the treatment. So sometimes we advise, when you're doing the scan, the person might not give you the details. He might tell you, you'll go back to the gynecologist. He will read the report, he will interpret it, and he will tell you the recommendations that he has, whether it's treatment, whether you're going to be given drugs, depending on what has been seen from the scanning. And that is the main reason why we do ultrasound scans. I hope we've educated you on that, and next time you're sent for a scan, you know why we do scans. It can be done once, it can be done twice, 3 times, depending on the indication. Okay, so we'll wish to welcome you again. We are planning for more videos. If you want to follow us, we've shared our social media pages on the screen. We have very many educative videos on TikTok. They're a bit shorter. On YouTube, we have longer videos. You can listen to them as you're driving to work or when you're at home. And you can visit us at Modern Gyno Clinic in Mombasa, Jubilee Building, first floor. Asanteni sana.